As Dr. Young knows, I've always preferred to work behind the scenes, not in front. And I didn't do all this alone. There was no way. But then I realized that this was an opportunity for me to personally thank all of you in oncology for all you have done and all you do every day for lung cancer patients. It also is an opportunity for me to let you know some unsung heroes without whom none of this could have happened. They played such important roles in bringing lung cancer out of the shadows, and it really, really was in the shadows. I was 50 years old when I was first diagnosed with lung cancer. The public perception at that time was that lung cancer was basically a punishment for smoking. I accepted that. I had the surgery, and I resolved to sin no more. However, 8 years later, it returned with a vengeance. Even though I had annual chest x-rays and blood tests, it was not diagnosed until I nearly died. The waiting room in George Washington Hospital in D.C. had a wall of pamphlets with information on various cancers, none of them specifically on lung cancer. One pamphlet had 2 sentences on lung cancer. It said, "Don't smoke," basically. Thank you. The web pages of the American Cancer Society and the American Lung Association had little else. The CDC did not even have a page on lung cancer. They only had information on tobacco cessation. I was really stunned. I was even more stunned by the statistics. I thought, like most people, that breast cancer was killing more women and prostate cancer killing more men than anything else. But when I found out that lung cancer was killing twice as many women and 3 times as many men, I could barely believe it. Oh, let me just show you my disclosure. Sorry, hold on. Okay. I had, as you heard earlier from Dr. Solano, I've been working for 20 years on Capitol Hill, and I frequently worked on health policy issues. I was also on Hillary Clinton's healthcare task force in the 90s. But lung cancer just wasn't discussed. Around this time, a key document was released. And this was the 2001 Progress Review Report on Lung Cancer by the National Cancer Institute. It stated the case very bluntly. Tobacco control will ameliorate but not eliminate lung cancer. We have funded lung cancer research far below other common malignancies and far out of proportion to its massive public health impact. So now, meet Priscilla Houghton. Priscilla Dewey Houghton, a most gracious woman, a beloved patron of the arts in Boston, and the wife of Congressman Amo Houghton, who was former CEO of Corning Glass. She was also a 3-time lung cancer survivor who had never smoked. Armed with the Progress Review report, we went to see Dr. Al Rabson. Rabson had been at NCI since 1975, and at the time of our visit, he was deputy director. He was a revered mentor to hundreds of researchers, perhaps even to some of you. Priscilla was ever gracious, but very firm. "Just tell us the truth, Al," she kept saying to him. The problem, he conceded, was political. There was little pressure on NCI within or coming from the outside to do more. Young researchers were not willing to risk their careers on an underfunded cancer that was so lethal, had such a bad reputation, and had no reliable funding support. Dr. Rabson's assessment was confirmed by Dr. Berlin, another legendary doctor and mentor who developed the concept of the physician scientist. Okay, we got it. It's political. But how are we going to build a movement for change when there were so few survivors. According to the CDC's annual snapshot at that time, of the 13 million people alive who had ever had a cancer diagnosis, over half had either breast cancer, prostate cancer, or colorectal cancer. That's the whole right side of that pie diagram. The lung cancer had 3%, less than 500,000 out of the 13 million, and the majority of them were too sick to become active advocates. So the first step we had to do was establish a beachhead in Washington, D.C., where policy was being made. At that time, there was only one small lung cancer organization. It was out on the West Coast in Washington State. It had been set up in 1995 by Peggy McCarthy, a medical writer, Mort Liebling, a patient, and Dr. Robert Ginsburg. Some of you may have heard of him. He was a highly respected thoracic surgeon from Canada who literally wrote the book on lung cancer surgery. In fact, he wrote 2 books. He was also a chain smoker. And he died of lung cancer in 2003 at the age of 62. A very sad attestation of the power of the addiction. Enter Jane Reese Colburn. Many of you may know her too. She was a breast cancer survivor in 1991, and she was one of the founders of the National Breast Cancer Coalition. Jane helped us get through all the legal hoops involved in moving that small organization from Washington State to Washington, D.C., and adding policy to the portfolio. We knew from the beginning that we also had to attack the stigma associated with lung cancer head-on. As if there were any doubt about it, we went to see Jack Valenti, the longtime lobbyist for the motion picture industry. And he told us, lung cancer, it's a dirty disease. No one wants to be involved with it. You'll never get a celebrity. Revlon, Avon, and other big companies supportive of research in women's cancers all had the same response. Lung cancer doesn't fit our image, even though they knew it was killing more women than breast cancer and all gynecological cancers combined. Now enter Diane Rothschild. Diane was one of the most extraordinary women I ever met. She was brilliant. She was the 3rd woman to be inducted into the One Club, the advertising industry's Hall of Fame. And she was one of the few women to have her own advertising agency. Do any of you remember the ads with the Range Rover covered with mud? Madison Avenue said, it'll never work. You can't sell a muddy car. Well, that ad broke all sales records for years. That was Diane. Excuse me. When we met, she had just been diagnosed with lung cancer at late stage, despite having annual checkups and chest x-rays. She was outraged by the misinformation, the stigma, and the research underfunding. So she prepared a series of ads. Here's one we ran in DC publications targeting Congress and public health agencies. This ad ran simultaneously in the New York Times, the Wall Street Journal, and the Washington Post. At 9:01 that morning, we heard complaints from NCI and others, the gist of which was, how dare they try to separate smoking and lung cancer? Well, Karen Pars was a real person, a never smoker, diagnosed at age 50. Her husband was a doctor. Despite her condition, she built the first online lung cancer research library before she died of her disease. Diane died too, and then Priscilla died. So we decided to hit the stigma even harder. We did not want to play the victim. We wanted to just present the facts and let the public and the policymakers see there was something wrong with current policy on lung cancer. These are the actual cancer deaths in 2010. Lung cancer is on the far left, and it is far and away the biggest killer. It still is. We wanted the public and policymakers to understand that women were being hit hard by lung cancer, and that among never smokers with lung cancer, women outnumbered men 2-1. Dr. Chris Latham, medical director at Dana-Farber, laid out the disproportionate impact of lung cancer on African American men and the limited access of both sexes to timely care. Dr. Sam Aguayo of the VA in Phoenix documented the high rate of lung cancer among veterans, especially those who had been in combat. With these facts, and thanks to Congressman and former Marine John Murtha, we were able to secure a new lung cancer research program funded through the Department of Defense that so far has brought in $127 million in new cancer research dollars. Robin Yabroff quantified the economic impact of lung cancer on Medicare. It is the biggest single driver of cancer costs under Medicare. Bruce Peinson is the principal actuary with Milliman, a leading international firm. With complete transparency, he released all the calculations of 3 analyses. They clearly demonstrated that CT lung cancer screening is more cost-effective than breast cancer, diabetes, HIV, and other commonly used screening regimens. No one has challenged his results. We explained that only 16% of lung cancer is being diagnosed at stage 1, and the correlation between a late-stage diagnosis and death. It took a long time to get lung cancer screening approved by the U.S. Preventive Services Task Force, covered by Medicare and commercial insurance, without co-pays or deductible side. But finally it was done by 2015. Of course, screening would have not been possible at all without Dr. Claudia Henschke. She literally pioneered the field and deserves full credit for developing and continuing to refine the CT screening protocol. Her consortium of 50 research sites and 7 foreign countries, 50 sites in the United States and 7 foreign countries, has collected data on 80,000 screened patients. The citation at the bottom of the page is to an article on her in the ASCO Post. Her findings on the efficacy of lung cancer screening has been validated by 2 large-scale randomized trials, as you heard earlier. They're showing the Nelson, which is not yet published, is showing a 26% mortality reduction in men, and even higher among women, possibly as high as 40 to 60%. With any other cancer, results like this would lead to a massive public health effort to implement screening. This has not happened with lung cancer, despite the fact it's the biggest cancer killer. Research presented at this year's ASCO just a few months ago in Chicago shows that less than 2% of eligibles are being screened, leading some to suggest that perhaps it should be mandatory. Dr. Bruce Johnson, a wonderful friend and supporter for years, whom you all know as the former president of ASCO, has called for public service campaigns like those for mammograms. Hopefully, his call to action will be heard. Dr. Jim Mulshine, I call him the Renaissance man of lung cancer. No one saw the whole picture like Jim. The science, the research, and the politics. He got it. He knows just about everyone in the field, here and abroad, a friend and mentor, an unsung hero. Simply put, the lung cancer movement would not have been possible without him. He and Claudia and others are expanding their screening research into early lung cancer treatment now. They are also working on a new paradigm in preventive medicine. In addition to lung cancer, that scan can detect coronary artery calcification, interstitial lung disease, breast density, bone density. I could go on and on. Imagine being able with one scan to catch early stage diseases that cause over 50% of all deaths in America. Their research with enhanced imaging continues to yield new and better tools. Just as you all have brought amazing new drugs into the arsenal, they too are bringing new imaging tools. Imagine combining the two. This comes from a CT scan. It's a 10 millimeter lung nodule, cancerous lung nodule. This is the same nodule. You could actually see the impact of a drug regimen on your patient. Think of the savings in time, effort, and money. And finally, I would like to recognize some local heroes, early believers, friends, and first responders, Dr. Enser of St. Agnes, Dr. Ellsworth of Holy Cross, Dr. Catania of AAMC, and the indefatigable Kathy Copertino of AAMC. As you can see for yourselves, there are many heroes in this, including all of you. Thank you.
Thank you for all the work that you've done and work with all the people. It's just so appreciated.